Good evening to the Knoxville College family and to the community at large. My name is Dr. Lindsey. I'm the interim president at Knoxville College. There's something new that we're doing this year as a partnership between Knoxville College and the United Way. We are actually putting on a COVID relief, but we're doing it in a pandemic relief seminar function so that we can have talks with you and to help you steer through this crisis. And so it is my pleasure to welcome you all who are listening on our website, who are listening on our various channels to this most unique, I would call it a unique program that we're doing to share good information, to hopefully encourage you and to inspire you and to let you know that we can definitely get through this together as a community, of believers, to have that patience and to have that faith in each other. And so I do want to welcome you all. Let's see. So today we're going to talk a little bit about health stressors, and I want to introduce some of the other speakers that we do have with us today. One is Dr. Cheryl Lee, and she will be following up with me next week, and she'll be talking about finance. Also, we have Dr. Ebony Bowers, who is with us, and she's going to talk about services, about what type of services are out there that can assist you. Following that, Dr. Jones is not with us, but he'll be talking about personal budgeting. So what do you need to do to help you and your family get through this? And on the last week, we're all going to be together as a roundup and talk a little bit about a group summary of everything that we've done, over the past 4 weeks, and have open dialogue with you. So hopefully you'll be able to jump on board with us, ask us any questions that you might have, so that we can make sure that we are getting information to you and just to dialogue with you just a little bit to see how you feel and to let us know what you thought. All of our sessions are going to start at 7, and we will go until the hour of 8, if not sooner. So we'll have some built-in time for you to ask questions, and we will definitely be able to go from there. Let's see if you can see those slides. We'll go over to your health and COVID-19. So tonight is really just an introduction to let you see a little bit about what we're going to talk about. And for me, working in public health, it's very interesting to see how we develop and how we create different programs to help people. Everywhere where you're listening, every community, every state is so different. But what we're really trying to do is to help people understand, even though there may be differences, there is a good way to find common ground and to have common rapport, and to make sure that the community is not being left behind in this process, but that we are all moving together. Next slide, please. And then the next slide. All right, and then the next one after that. Perfect. So what is it that we know about, the novel coronavirus, aka COVID-19? We know that this has been such a year of circumstance. It's been such a year of presentation. It has been a challenge on all of us. And when we look at how COVID-19 has affected our health, this is more than those who may have contracted the disease, those who have been exposed to disease, the testing that you've had to go through. the vaccinations and all the trials that are going on. But what does it do for us personally? And as we, in the field of public health, we always look at those things. We look at individual health, we look at community health, and we find a way to marry those two things together to make sure that we position good programs, to make sure that we prepare good programs, we package good programs, and then we present them to the community. But for those of us, when we look at our own personal health, if you looked and you said, well, how many of you have pre-existing conditions? Do you have diabetes? Do you have high blood pressure? Are you old? Are you a minority? All of these things play a role in determining your health and whether or not you are more susceptible to COVID-19. And so as this year has progressed, we have seen how this has taken a toll on our people. And this is not just for the minority population, it is for all of the people all across this country. And so it brings about high levels of stress. It brings out anxiety. And it brings out a lot of stress and anxiety because we're trying to figure out, what do we do? And really, we are all learning this on the fly. There is not one person that says, I have all the answers to everything that you might see. From losing family members, from maybe you even personally contracting COVID-19 and having to be hospitalized or having to go through those rigors of trying to get yourself healthy again. And the after effects of COVID-19. How does your body respond once you have had it? What are all of the things that happen? Yes, that does bring out stress, and it also brings out that anxiety. It brings out, loneliness. We've had a lot of loneliness. Why? Because we've had to be so isolated. And so even in our minds, we're looking at this social isolation. We're looking at this loneliness. We're looking at the bubbles, that we've had to be in. And we try to figure this out. And how does that also affect your personal health? There's a fear involved because now we're looking at transmittal. We're looking at, well, how do we avoid getting it? So now we become fearful of each other. We become fearful of environment, fearful to travel, fearful to congregate. And so when you wrap all of those things together, it then makes you angry because now you want to say, we want to go out. We want to do things. We want to be together. And that is not a bad thing because we as humans, we are social creatures. We want to be around each other. We desire that level of attention and affection. And so when it is peeled back, it does bring up that anger. It does bring out that resentment. It does bring out that attitude of, why can't I? And so all of these things that kind of wrap and piece themselves together, they are the natural human emotions that we do exhibit. But then from a public health standpoint, we have to look at understanding those things and understanding what must we do to make sure that you understand the risk and then try to protect you. Next slide, please. And so as we continue to look at those issues, it also brings up excitement because even as we're going through this, we want to know that there's going to be something at the end of this tunnel, to know that there's something at the end of this rainbow. And so we are desperately always seeking solution. And so when we see things pop up, we get happy because we're thinking to ourselves, yes, we may be able to be in a place where we don't have to do these things anymore. But then you find yourself having this level of distrust. You find having this level of disbelief, because now you're trying to think to yourselves, oh my gosh, who do I trust? Oh my gosh, which words do I believe? Who do I believe? That's not what I heard from over here. That's not what this person said. But this person says this, but I'm hearing a different message over here. And so once you begin to get those, what I call duplicit, messages, they become very confusing. And so now you don't trust anything that is being said by people, because it's either being disowned, refuted, or disavowed. And so now it brings up all of those emotions that were just stirring up on that last slide, to say, I thought we were making progress, but now we're here. And so with everything that we do see, it drives us to now be distrustful of the very system, that is here to protect us. We become very disbelieving of the words that are being said, of the mechanisms that are being proposed and being put into place. So then, there's always that common phrase that, something's going to drive me, to the bottle, or something's going to make me go over this edge. And so now we find people turning to other ways to solve these problems and these issues. And so, yes, we do find substance abuse, that grows in these different levels. Because how do you combat that loneliness, that fear, that anger? A lot of people go out and say, man, I'm going to go have a drink. I'm going to go, smoke. I'm going to go, but these habits also become very dangerous, because they now become replacement strategies, replacement soothing mechanisms. And so now we still try to figure out what is the path that we need to take, and then what is the best way for us to go about trying to accomplish it. And so for those of us that have families and we have loved ones that we may have lost to this coronavirus, families that we have to protect, how do we strike that balance between keeping our families safe and being able to still function as people? That also becomes a big challenge, because when you look at, if you have, a son or a daughter, you have, a husband, you have a wife, you have grandparents, you have aunts and uncles, and you have this extended family that is around. For those who are fortunate, as 2020 comes to an end, but some of us started the year with family members that we won't end this year with. Some of us are going to start the year out with friends that we're not going to end this year with. And so all of this balance of family and what do we do that is in the best interest of our families is an integral role in your health. Because literally, stress does two things. There's good stress and there's bad stress. And in this situation, most of it is bad stress, that results in, ulcers and high blood pressure and all of the bad things that could come along with it. But we have to find a way to channel those stressors and channel and turn these things around for the greater good. We look at your finances. Finances drive health. We're looking at people who, within the sound of my voice, that at the beginning of this year are not working the same number of hours, may not be working in their same careers, may have been laid off, may have been fired, may have been furloughed. But we still have bills. We still have family. We still have to eat. We still have a lot of things. Life doesn't stop because of this virus. But it has altered life in an unimaginable way that we would not have thought about on January the 1st, the same way we think on November the 4th. And so it is a very telling set of circumstances. It is an unfortunate series of events that they almost seem to snowball on each other. But this is not the end. We will get through this. But it is where we come together as a community to talk about these issues, to help find resources, to help be able to guide and figure out how do we make it. And that is what drives us to this theory called a social determinant. Next slide, please. And so when we discuss social determinants, we're not looking at this under a lens of socialism or being socialized, but social determinants of health. And up here is a long definition of what is a social determinant of health. And to put this into a nutshell and to paraphrase this meaning, this is, how do we work? How do we survive? How do we interact in our work environment, home environment, play together, worship together, and how does it affect our life outcomes? So basically, this social determinant is looking at understanding who you are as an individual, the role that you play in the community, and how do these environments intertwine with one another so that we just don't look at each other from a social economic standpoint, but how do we look at each other as equal members of our community, that we bring the best of our assets and skills and knowledge and skill sets to the table to make sure that our community functions. But at the same time, understanding that, just like Mr. Rogers' neighborhood, who are the people, in your neighborhood? Who are these people that you see and interact with every day? That is what they referently call as our place. It's our neighborhood. And so we look at, this through the prism of looking at Mr. Rogers' neighborhood. I remember watching that cartoon, watching that live show as a child, and watching Fred Rogers put on that red sweater, throw on those sneakers, and meet different people. Those premises. We also look at how do those social determinants continue to move us? How do they inspire us? But how do they invoke us to think about the least of these, even in our community settings, as we move, live, learn, work, and play? That is something that cuts to the very fiber of our being. And that is what, from a health standpoint, is what we look at. And so when we look at this by the numbers, next slide, please, we understand that there are some numbers that tell us the conditions about how we function and what are those problems and what are those issues. And so when we look at this very issue right now, over half of adults report that there's been some negative impact to their mental health because of worry and stress with the coronavirus. And those are just the adults. We don't think about our children that also feel these effects. And then we look at almost half of the adults reporting negative effects. Those are your stressors that I was talking about earlier. And so when we once again look at those determinants, we're looking at where do we live? Where do we work? Where do we play? But now here's a different one. How do we learn? And so even with this coronavirus, there is a learning aspect to it. And we are learning every day about each other. And sometimes there's nothing like the old phrase is there's nothing like a crisis to get to know the people that you thought you knew. You find out people's character when times are rough. And so now these are all of the things that we learn and we package together. And we figure out that, yes, it does weigh on us, both positive and negative. And we have to discover, how do we learn and grow from this? It's not a zero-sum game. It is a building block of experiences. And so the challenge is, how do we take those experiences and how do we grow from them? How do we take what we're learning? How do we apply it and grow from it? How do we take what didn't go right and strategize and plan to help make things go better? And that is what we always strive and should strive to do. To look at what is good and make it better, to take what's bad and make it good. So that we're always, always, always looking forward. Not forgetting what happened in the past, but if we remain stuck on the past, we will become history. But we can use the past and use this history of the things that we've learned over these last 7 to 8 months and use it to improve our society and strengthen our community. Next slide, please. And so, what are our greatest needs? Our greatest needs are looking at access to services. Where in our community, how do we gain access to these things? What are the organizations that are out there assisting people during this most troubling time? For most people, there are resources out there, but they don't know how to get to them. Because there's no one saying, hey, I have this resource here. And this is how you can access it. But for some people, it may mean, I need a ride. Well, that means there's services out there for people to help to try to get you there. And so with everything, we don't want the access to be a determinant, to be a distractor. What is our greatest need? Looking at short and long-term planning. As a community, we have to do this. We have to look to see what is going to be our end game. What is going to be our long range and short-term planning and assessment goals. Because now as we move into the winter months, how do we plan for it? When we move back into our warmer months, how do we plan for it? And so these are things that from a community standpoint become the foundation of our need. Because I remember the words of my first grade teacher. And Mrs. Reed was one of my favorite teachers when I grew up. But she gave me this phrase, and she told it to me at the age of 6 in first grade to my class that I've always remembered. And she only said these words: if you fail to prepare, you prepare to fail. And so planning and preparation is a vital cog to any and everything that we ever hope to accomplish during this time. We all want economic security. We all look at economic stability. And right now it wavers because of businesses that we had at the beginning of the year that we don't have anymore. For those that work in service industries that find your times and hours cut. When we look at the movie theater and the entertainment industry closing doors and not knowing if they're ever going to reopen, it brings about some instability and some instability. But now we look at how do we still plan? How do we still budget? And I would urge anyone, if you have not started to budget from this point, now is a good time to pull out those books and to start budgeting. Know where your money is going and know how you plan to spend it. So I think that session is going to be very interesting, on that budgeting. And last but not least is to continue to see your doctors and continue to have the access to the care that you need. And so that also becomes the greatest need, that you do not stop getting the care that you need to make sure you stay in optimum health. I was just at the doctor yesterday, getting my annual physical. Was it different? Yes. Is it needed? Yes, it is. And so I encourage everyone, we have to continue with those little things and being able to keep your access. And if you need that medical care, if you need, testing, if you need to be seen, how do you do it? Even in this difficult time, it is still there. But now we have to be looking at each other to say, are these our, how do we find those results? How do we look and stay focused on individual health that in the end helps community health? Next slide, please. And so as we continue to look at this, I call it the village. We are a village. Whether you are a billionaire or whether you have one penny in your pocket, we are all a part of this village. We are all in this thing together. And so community engagement and support, this is what we have to turn our attention to. Because when we talk about, community engagement, this is more than just come over here and get something for yourself. But how do we as a community band together? And how do we strategize together? How do we plan together? How do we sit around the table together and find the best things that work for our community? Now, I will say this. What works in Knoxville may not work in a Columbia, South Carolina. It may not work in a Bowie, Maryland. It may not work in Washington, D.C. It may not work wherever city that you're listening to this presentation. But the engagement part does not change. But the engagement now morphs according to the needs of your individual community. And so when we look at that, we know that it's nothing that really separates us. It's understanding who are we in this community. And so when we look at this pandemic, we look at science, and we often hear, what does the science tell us? Or how does the science lead us? But how well do you understand those that knowledge, that terminology, all of the lingos that you might hear. I can sit here and rattle off a ton of public health, theory and words and slogans, and you'll sit there and be like, I don't understand it. But at this time, we have to figure out, how do we turn this into layman's language so that everyone can understand where we are. That is another big part that engagement builds on, is getting us all on the same level. Because when we look at public individual health, why do we have such a hard time? Why do we have such resistance to wearing a mask? Why do we have resistance to limited numbers of engagement? It's because of personal risk. And that is Public Health 101, is understanding a person's own risk, to then understand, how do we find ways for education? And so what we look at is, how do you find that balance between individual and personal health versus the health of a community? And so there are a lot of big words that get floated out there, in that world. But the only thing that I'll leave you with is this: your attitude towards the pandemic is not based on science. It's not based on any of those things. It's based on your own individual assessment of how you feel it's going to affect you. And based on that premise, you now reach a conclusion. Now that's, if this, then this. And so, yes, does it create levels of misunderstanding? Yes. Does it create heightened tension? Yes. Does it create arguments and become argumentative and combative situations? Yes. It creates and presents all of those things rolled up into one. But it is because we don't really look at not just an individual, but how does it affect the next person? How does it affect my neighbor? Who is my neighbor? Who is my brother? And so when we ask those questions, who is my sister? These are the things that help us start to find that balance. That is why the village becomes so much more important. And this starts with leadership. All of these things start from the top. We follow and we look at our leaders for example. And so we have to understand that sometimes that personal health is not always the first thing that pops into mind, but all of the messaging has to encompass both of those pictures: health of the individual, health for the community. And I think that if we begin to have those conversations more in earnest, I think that we'll see a difference in our attitudes. We'll find a difference in how we approach, a lot of these issues, because then we'll be looking at it twofold, but we'll be looking at it more as a community-minded village. Next slide, please. And so as I close, for this first session, I want to thank you all. I want to thank, the United Way for putting this together for us, and, allowing, for granting us, the opportunity to partner together to do these workshops. And so I believe that as we continue to move and as we continue to grow, we're going to do this together. No one person is going to beat this virus back. No one person has the right answer to everything. But for us at this time, it is really a calling for us to look deep inside of ourselves and say, look, we can do this together. We can make it together. And I truly believe that we can do it if we move together. And so this is, the whole start of the conversation that we're going to have, over the next few weeks. And we're going to ask you, write down these questions, if you have them, and send them to us and put them in those comment boxes so that we can have them. And at the end, we're going to talk about these things every day. We're going to have that Q&A, and we want to know what's on your mind, because I truly believe that this is a community building activity, and it is one that will take us far. And this is something that you can use in your communities, both far and wide, to ensure that the village becomes stronger through this pandemic and does not become weaker. A weaker community is not a good community. Whether we're in a pandemic or even if we're in all perfect health, a weak community cannot be a good community. So we have to bind together, hold each other up, support each other, encourage each other, and focus on not what's going bad, but what can we do to make sure that it goes well, and to put those things in place that will continue to help us get well. Because right now we have something, there's a thing that we call a sick building syndrome. But right now we're in sick country syndrome. And we have to find a way to move from that sickness back to wellness. That is personal, that is city, that is state, that is nation, that is our world. And so we're going to move that conversation forward. And so we look forward to interacting with you. We look forward to having these in-depth conversations about how do we move our village. And so if I could leave you with anything, I leave you with that one thought, that we are definitely a village, and we're all going to have to work together if we want to be successful. So I thank you all for the time that you have spent with us this evening. We will be, let me check. Do we have any questions in the box? If we do, I'll look at some of those and try to answer them. And that's what we're really going to turn our focus towards. And so you're going to hear some dynamic presentations, over the next couple of weeks. And it's really going to move us and drive us in a direction that is just going to blow our minds, but it's going to pull us together. Do we have any questions in the box? Okay, perfect. So even though we may not have any questions today, that is all right. Next week, we will have Dr. Cheryl Lee. She will be with us on Tuesday, November the 10th at 7. So please, I invite you to tune in to hear Dr. Lee's performance. This is a dynamic woman, that you're going to hear from with a depth of experience. I mean, a depth of experience. And so I guarantee you will not be disappointed to listen to her next week. I thank you all, this evening for your time. If you do have any questions, please throw them in the box, even if you did not want to ask one right now. If you think of something, go onto our website, knoxvillecollege.edu under our pandemic relief seminar tab. Leave your comment in the box. We will definitely get them, and we'll respond to them either in a future session or, at the end. But please know we will definitely get the answers to the questions that you do have. So I thank you all for your time this evening. I look forward to seeing you next Tuesday. You will not hear my voice except to introduce, our next dynamic speaker and presenter. And I hope that you all continue to have a safe week, a prosperous week. And I look forward to seeing you all on Tuesday at 7. Everyone take care and have a good evening.